Welcome. Good morning to those of you that this is morning for, and for everyone else, good afternoon. That would be me. I'm on the East Coast. My name is Natalie Burke. I am President and CEO of Common Health Action, and today I get the honor of being speaker and moderator and a time manager to some degree to help us move through a really important and sometimes difficult conversation. Now, today I want to talk to you a little bit about health equity, identity, power, and policy. So a few things. I'm going to tell you about my story, but not. I'm going to talk about our bodies, power, and policy. And these are big and weighty topics. Now, I have to tell you, one of my things, and if you could see me, you could kind of see me, it's even on my t-shirt, it says get uncomfortable. And this is part of the role that I try to play in the world. My job to some degree is to orchestrate constructive discomfort when I'm with groups like this, because I'm a firm believer that in order for us to create any change, whether that's within ourselves, within a culture, within society, within the world, we actually have to lean into, seek, and embrace this concept of being uncomfortable. Now, I want to be clear, to be uncomfortable is not to be unsafe. They're two very different things. So I encourage you to join me, and at certain junctures to get a little bit uncomfortable with what you hear, and maybe even with what you feel, because this isn't just a thinking conversation, it is also a feeling conversation. So my hope is that you will have some things to think about, concepts and ideas, that you will have things to talk about. And that's not just for our time today, but that's also after you leave this convening of people. Where is my head? Where's my mind today? So I have to be honest with you all. Last night, I spent a lot of time figuring out what I wanted to say and what the story was that I wanted to tell, because part of my role in the world is also to be a bit of a storyteller. So my story actually starts with my grandparents to a large degree. That's them on their wedding day in the middle. And I'm a child of immigrants. My family comes from Jamaica. I grew up in a multi-generational household in Hollis, Queens, New York, the home of rap. Yes, I said rap, not hip hop. I'm telling you how old I really am. And these two people were really important to me because I got to grow up in a house with them. When I got to college, it felt like they got old overnight. And it's the reason I decided to go into public health, because of the challenges that they had accessing care, culturally competent care, quality health care in their senior years. On the right-hand side, who you'll see is my great-grandmother, my grandfather's mother. And she ties into this story. This is her with my father on her lap. My father often tells a story about how he held her hand and watched her take her last breaths. I didn't find out until a few years ago those last breaths were because she had breast cancer. So for me, the roots of this ran even deeper than I realized up until a few years ago. Fast forward to some degree, and this is my good girlfriend, my sister friend. And this is why it was emotional for me to put this together, to share these pictures and to tell this story. But this is why it was important for me to be here with you today. This is Lorette. This is someone who I met basically on the first day of college, and we've been friends ever since. Lorette had cancer, breast cancer, back at the end of 2014, going into 2015. And she rang the bell, and it was a wrap. And she went on to live life. So here we are in 2017 at a basketball game. She came down, her husband was coaching the opposing team, and this was our alma mater, so we had a great time. At halftime, she got up and she stretched, and when she stretched, she grabbed under her armpit. And I said, "What's wrong?" And she said, "Oh, I've been in the gym killing it. I think I just did a little bit too much." I said, "Oh, okay." Sunday, that was Saturday. Sunday, when she woke up, she tried to lift her arm and couldn't get it above her shoulder. She realized something was wrong. Monday, she went to the doctor. Tuesday, she got her results. And Wednesday, she started chemo. She had a very aggressive form of cancer on the opposite side, a different type of breast cancer than she had originally had. And it had already metastasized. The crazy part was it happened in under 6 weeks. She had had scans 6 weeks prior to that and was on tamoxifen. To say that this was mind-blowing is an understatement. So from that time until now, I have done everything that I can to be supportive, to spend time with her, and to say yes to anybody who's working on Black women and breast cancer. Right now, the struggle is really hard. It's hard for me to talk about this today because this was my last text from her on January 7th. I said, hey, girlie, how has the week been so far? I'm recovering from Burke's, meeting my family from the holidays. And that was her response. Can't talk now, sweetie, but my body has had a really rough week. To say that I am drained and exhausted is an understatement. We've essentially run out of treatment options. Hospice is coming to visit on Sunday. Wish I could talk, explain more, but I'm just so tired, my sis, love you. This text message is one of the hardest text messages I've ever received. And to be honest with you, what I did not recognize, and I talked to Reverend Tammie about this, I started grieving when I got this message. Now she's still with us. She's still fighting the fight, but every day it's getting harder. So this is my story about why I needed to be here with you today. Here's what I realized when I think about my great-grandmother's story to some degree, but about Lorette's story, that's really clear. There are no accidents. Health inequities happen because of social identity, power, and policy. And I want to be really clear about that. Social identity being the intersection of womanhood and Blackness in this country leads down a path of health inequity. And so we have to be honest about that. And in that, we have to recognize that Black women's bodies are not broken. There is a narrative that there is something wrong with us, inherently wrong with us. And that's really not the case. And so we need to reclaim the narrative about our own bodies. Our bodies and the thought of our health should not be wrapped in shame or in blame. And I think too many times when we have these conversations about the inequities in breast cancer experienced by Black women, I feel it. It's a film that wraps around the conversation sometimes. That's almost like, what did she do wrong? And I want to make sure that we lift that up and we're really clear, and it's time for us to dispense with that. It's actually rooted deeply in a concept of anti-Blackness that we see, feel, and hear in the structures and the institutions that are put in place and held in place by public policy that does not value us within the context of who we are. That being said, a point that's really important is that your health is not an accident, it's a production of society. It's about 10 to 20% genetic, 30 to 40% based on your personal behavioral choices. Do you eat right, diet, exercise, engage in risky behavior, wear a seatbelt, wear a condom, wash your hands, right? But the other 40 to 50% is based on what we call the social determinants of health. Things like housing, education, transportation, structural racism, access to healthcare. Those structures and those institutions and the policies that keep them in place create the context and the construct within which every Black woman lives her life and makes her decisions. And they do a great deal to determine whether or not she has the opportunity to be healthy. How does that play out? It plays out often based on power. So this is a really simple definition, and sometimes we throw the word power around and we don't really stop to make sure that we're understanding it in the same way. I wanted to share this one with you today, that hopefully it can ground us as we talk about power throughout this conversation. Power is not power is the ability to define reality for yourself and for others. Power is the ability to define reality for yourself and for others. Can you see why then power and policy are inextricably linked and how important that is? Public policy has created the context and the construct for people in this country, and certainly for Black people in this country for over 400 years. Whether it's that you're looking at American slavery or segregation or the post-segregation period, whether you're thinking about the redlining of communities that delayed the accumulation of generational wealth for Black families, whether you're looking at mass incarceration, all of these public policy-driven decisions that are in place because of people in power have created a context and a construct that has led to the health inequities that we see, specifically as it relates to Black women and breast cancer. One of the things I want to point out to you that's important, when we talk about this, you'll notice I'm saying inequity. I'm not saying disparity. And there's a reason. If you cannot name a problem, you cannot solve a problem. So it's really, really important that we say inequity, and here's why. A health disparity is merely a difference in health status or outcomes between groups of people. The difference in and of itself is not a bad thing. So think of it like this. If you were to think of males and females and rates of breast cancer, you would find that females have much higher rates of breast cancer. That is biologically driven. It just is. That is a disparity. It's a difference. But a health inequity is a specific type of disparity. A health inequity is a disparity that is the result of systemic, preventable, avoidable, and unjust social, economic policies and practices that create barriers to opportunities for health. So when we talk about what Black women experience in systems and institutions with regard to access to care when they get diagnosed, the quality of care that they experience, the likelihood that they have access to the drugs that they need, the likelihood that they have an employer and a workplace that can support them as they move through their journey, right? We've got to begin to think about these things as systemic, preventable, avoidable, and unjust policies and practices. Okay, and that's why they are inequities and not just disparities. So on the flip side, what is health equity? Health equity is the assurance that in essence, all people have conditions that will allow them to get to their best possible health. Health equity means that we are valuing all people and all populations equally, recognizing and rectifying historical injustices and providing resources according to what people need. And this is from Dr. Kamara Jones. Health equity requires us to provide all people with fair opportunities to achieve their best possible health. People get stuck on the word fair because they think it's subjective and it can't be measured. So what is fair? Fair is whatever is necessary to get a person, a family, a community, or a population to the best possible outcome. That's what's fair. So what we're looking for is equitable and fair policies to create conditions where Black women have every single opportunity as it relates to breast cancer. What does that mean? We need systems, institutions, and practices that value people, not in spite of who they are, but because of who they are. How do we do that? Well, through policy, right? So we've got to become the superheroes that can carry policy forward. One thing in the course of this conversation that I want to remind you of, when we look at the historical context for public policy in America, particularly as it relates to Black people, it can become overwhelming. And I love this quote because it says, "They tried to bury us, they didn't know we were seeds." When you look around you and you see the fact that we're still here, we are still here, it indicates that in the midst of all of it, the adversity, the level of resilience that Black women have had in the midst of all of that indicates that we're still not going to go anywhere. So I'm here with you today because I would prefer that there is never another Lorette. I would prefer that never will anyone have to experience what she is going through right now, what her husband and her son and her mother are going through, and all of us who love her are going through. And I hope that today we can have a meaningful conversation that'll help you know how to contribute through policy to create the conditions and the constructs where every Black woman has every opportunity to reach her optimal health, especially as it relates to breast cancer. So that's a little bit about me, background, how I'm here, how I'm going to moderate the conversation to some degree, where I'm coming from. So when I say things, you'll know why. Technically, I'm a public health professional, right? So this is all very meaningful to me. And if you want additional information about anything that I've talked about, you'll see here that I have QR codes that you can scan. On my Medium site, I have a number of articles that talk about health inequities and about Black women that might be of use to you. It is my honor and my pleasure to introduce you to Reverend Tammie Denyse, who is the co-founder, president, and visionary for Carrie's Touch. She's a 17-year breast cancer survivor, ordained clergywoman, and an international speaker and breast cancer advocate. Reverend Tammie uses intersections of faith, education, and her life experiences to create a heart-centered approach to healing and wellness. I hope you all are looking forward to hearing her as much as I am. Reverend Tammie.
Good morning, good afternoon, and wow, I just have to start by saying thank you so much, Natalie. I mean, I was, I knew I was on camera. I didn't want to go off camera, but truth is how I get down. And I was just like, yes, sis, do it, do it. Yes, yes, say all the things. Don't be afraid. And so thank you so much for laying such a phenomenal foundation for today's very important discussion. Yesterday when, first of all, I hate bios and people are always asking for your bio. They want to know, who you are and what you've done and all these things. And on one side, I say, bios are great because they tell people what you've done. But in my mind, I'm like, yeah, but that's what you did yesterday. You could lose your mind and not do anything else going forward. And then we got this bio by which we're, at any rate. Then as we were, streamlining these bios, because everybody is so phenomenal and everybody has such a wide breadth of work. I was looking at myself, and at a moment I just said, I'm not just a visionary. I'm not just a breast cancer survivor. I'm not these things. What I really am at my core is I am a little Black girl from Indianapolis, Indiana, racist Indiana, who experienced trauma from the moment I can remember. I am a little Black girl that overcame being a product of domestic violence. I'm this little Black girl that just by the tone of my skin, I was counted out in society. I'm this little Black girl that people said, you're not going to make it. There's a study, the adverse childhood early experiences. I'm messing it up, but it's the ACEs study. And there's 10 questions that you take that determines your probability of having poor health later on in life. And on that study, I answer all 10 of those questions. So based on that projection, I actually should be dead. And then I came about and I looked at my breast cancer journey as it relates specifically to this conversation. And 17 years ago, when I heard those words, you have breast cancer. And while that may not be uncommon for folks sitting in this Zoom room today, what is uncommon is the opportunity when my doctor came in and offered me an opportunity to participate in a clinical trial. And he didn't know how little Black girls from Indiana or anywhere else in the nation were responding to these drugs that he was offering to me as an opportunity at life. So juggling life and death has been a lifelong experience for me. And as I come to today's conversation, I am troubled in my spirit because we are still having this conversation. People talk about social determinants of health, and I love the way you laid it out, Natalie. And very rarely do you see people that call social determinants of health what they really are: social constructs that are used to actually blame the victims for being poor, blame the victims for being Black, blame the victims for unjust systems. And so when I was diagnosed, I didn't see people that looked like me that were surviving the disease. You see the races with women running with their arms up, crossing the finish line. They are proclaiming that they're an X number survivor. I'm a 1-year survivor. I'm a 5-year survivor. But when you see the Black women, it says I'm running in memory of. So subliminally, they're telling us that we can't survive this disease. And when I went to the support groups, there was nobody in the support group that looked like me. So my late sister, Lynn Marie Rankin Cochran, I call her name today, and I ask her to be with me in this moment and on this journey. She's no longer with us. She didn't succumb to breast cancer. She succumbed to another type of cancer. But her story is she too was a Black woman just trying to figure out how we navigate this space that we're in toward healing. And how we didn't even know the words health equity back then. We didn't know what to do with it. We didn't know how to respond to it. And so I said, I want to do something about it. I want to do more than just acknowledge the fact that there isn't anything here. I want to do more than the fact that people are saying that, you know, you're not going to live to see your 5-year cancer anniversary. Well, I'm 17, so I beat the odds by 17 years at minimum. But what's so difficult about that is 17 years ago, my doctor said, Black women are dying at the rates of about 41% higher than white women from this same disease. And what's disheartening about that statistic is today, 2222, Black women are still dying at approximately 41% higher rates than white women. So this discussion today is grounded in centering Black women and hearing our stories and understanding that collectively, together, we can affect change because we have the power to do it. All we have to do is have the courage. So as we navigate this space today, I'm asking each of you to dig deep within and ask yourself, do I have the courage to stand on the platform that needs to be necessary, that is necessary to join forces with those who are actually trying to move the needle and save lives? You know, life and death can be difficult because when I encounter a breast cancer survivor and I ask her what's her greatest fear, it's typically one of two things. They're afraid to die and they're afraid to lose their hair. And I said, well, I can help you with one and the other one is out of our control. We are all going to die. So let's not get caught up in death. Let's figure out not only how we can live, but how we can live well and how we can live well together. I am my sister's keeper. I am my brother's keeper. There's an African concept called Ubuntu. I am because you are. And it means that together we have a greater opportunity as a whole than we ever will individually. So today we are banding together. We're looking at clinical trials. If you look in the research world right now, diversifying clinical trials is all the rage. You know, it's horrible what happened in 2020 that catapulted the conversation about race relations onto the national stage and became part of a dialogue that we are normally not part of. But the thing that came out of it is that this conversation is on the national stage. And so diversifying clinical trials is on everybody's topics, but I say we gotta pause. Yes, there needs to be more representation in clinical trials, but we gotta pause. Yes, we have to advance the research, but we gotta pause because Black people always are told to get over it. And nobody ever stops and acknowledges the atrocities that have taken place in our lives and the trauma with which we live by every single day. So I am saying push pause and hold folk accountable. I love it, Natalie, when you said we can't fix a problem until we name a problem. And that's part of the pause, right? It's pushing pause and saying, let's look at what happened in our past so that we don't repeat it. Because ignorance will only lead to us repeating the same mistakes that were repeated, that happened in the past. So I'm gonna come back more times. Y'all are gonna hear a lot from me today. I just wanted to get on and just say, thank you for being here, and challenge you with the question, do you have the courage to be part of the change? Thank you.
Thank you so much, Reverend Tammie, and thank you for really reinforcing this idea of being powerful. That idea of being courageous is directly connected to this idea of being powerful, and a recognition that every single person who's here today has power to influence, to impact, and to affect what's happening with policies that create the context for Black women's lives, right? So I just want to thank you for lifting that back up again. Now I have the pleasure of introducing Reverend Dr. Tawana Davis, who is a mobilizer for Carrie's Touch. So she's helping to keep it moving. She is a 5.5-year metastatic breast cancer survivor in active treatment. Thank you so much, Reverend Dr. Tawana Davis. And I'm going to go ahead and turn it over to you.
Thank you. What an honor and a privilege to be a part of this intimate conversations, Humanizing Policy. And I have the opportunity to talk about the power of language. And I promise you, Tammie, Natalie, and I did not get together. This is truly in divine order. And you'll see as I go through this storytelling and words and concepts that this is truly a divine moment. So listen, receive, embrace, acknowledge, and let us work through this power of language. According to Paulo Freire, and I paraphrase, the call for language clarity is an ideological, humanitarian, political, philosophical, ethical, and moral issue, not merely a linguistic one, not merely semantic, not merely talking a good game, not merely talking because someone has lips. The power of language is about naming the ills and addressing, dismantling, disrupting that which is causing us to suffer. And we heard a bit of that from Natalie in her introduction. For Carrie's Touch, the power of language is choosing to act in our freedom on behalf of our liberation. For Carrie's Touch, the power of language includes recognizing that self-care for Black women is a communal endeavor as healing, justice, and love that demands interdependence in our language, unapologetic stance, and power. Engaging in self-care as Black women is to affirm our individual and collective worthiness and value, particularly during a diagnosis of breast cancer and other diseases that plague the Black community. So as I go through these terms, I would prefer to do it through a form of storytelling, again, as Natalie and Reverend Tammie mentioned. So I was diagnosed in November of 2016. And when I heard the words, "You have breast cancer," it was as if the Charlie Brown teacher was talking to me. I had no idea what HER2 positive was. I had no idea what metastatic breast cancer was. I had no idea of what treatment was, the impact of chemotherapy. I had an idea because my mother succumbed to multiple myeloma when I was 23 in 1993 due to challenges. So I knew a little bit of that, but time and energy has evolved and we have learned new ways to treat cancer. So a lot of this was new to me. So in that moment, I knew that I could not do this by myself. So our first term for today is activist or advocate. It's someone or an entity that speaks on behalf or shows up for someone who is historically silenced, marginalized, and dehumanized, to name and dismantle oppressive systems and create spaces of healing, liberation, humanization, and inclusion. So I had to call on my activists and my advocates. I had to call on Carrie's Touch. Reverend Tammie and I have been friends for numerous years. I had to call on my people. I was a volunteer for breast cancer survivors for many years prior to my diagnosis, not understanding why Spirit was calling me to this endeavor. And then I realized that when I was diagnosed, I was able to take all that I've learned and all that I have witnessed and incorporate it into my own healing. So having a village or a tribe, or as Tammie mentioned, Ubuntu, I am because you are, it is important to have an advocate or an activist by your side to take notes, to be on camera when you're in the doctor's appointment, because we're in the midst of COVID. They may not be able to go to the doctor with you. So having someone there to translate, to take notes, to ask the hard questions is so important on this healing journey of breast cancer. We also heard terms of diversity, equity, and inclusion, right? So from a Black woman standpoint, as Natalie so eloquently stated earlier today, diversity includes all the ways in which people differ, and those differences should be recognized, humanized, and valued. So when I walk into a doctor's office, I expect to be seen as a Black woman. I expect to be seen as a Black woman who has a 41% morbidity rate as it compares to white women, as Tammie said. I expect to be seen holistically, mind, body, and spirit, to address the concerns and the ills that are stopping me from receiving adequate care. Diversity also includes diversity on the other end. My healthcare providers, my patient advocate, they all should represent the communities that they serve, which brings me to equity. Is the call to address the systemic root causes of these inequities and not just their manifestation due to race, class, ability, and beliefs. Equity ensures that historically marginalized and oppressed non-white people are represented according to the communities that they serve. So equity not only from those who are serving us, but in equity to access to these things, to clinical trials, to adequate health care, to adequate health insurance, to adequate supermarkets and healthy food. That is what equity is about, because it's dismantling systems that were designed to harm us and not to empower us to survive and thrive in the midst of our diagnosis of breast cancer. Which brings me to inclusion, is authentically bringing traditionally excluded individuals and or groups and processes, activities, and decision and policy making in a way that shares power. Power over is rooted in white privilege. Power over is rooted in white power. Power over is very individualistic. It's very self-centered. It's very narcissistic. Power with is very encouraging, very empowering. It's sharing stories, it's sharing experiences, it's understanding that overall there is this definition of breast cancer and different types of breast cancer, but each experience is different. So having all of those stories included in the narrative so the needs can be met by historically marginalized, oppressed, and often silenced groups. Now, we heard about health and healthy. Health is a mental or physical condition, but healthy is living in a way that gives life to one's mind, body, spirit, and soul. Natalie, again, eloquently talked about health equity. And if I can summarize, it's the principle underlying commitment to reduce and ultimately eliminate disparities in health and its determinants. Now, we heard Reverend Tammie talk about these determinants, and Natalie talk about it's not our blame. It's not for people to blame us for these determinants. It's not the shame of these determinants, because the determinants, the social determinants of health, are systemic. They are systemic ills that are plaguing us, and we should not be looked upon as it is our fault or wear the brunt of that. It takes a village, and it takes policy, and it takes our voices and the power of language to insert that into a narrative or dismantle the narrative altogether and rebuild policies and procedures and have legislators speak for us and by us in those spaces and at the table, so that we can live again and not die at the hands of breast cancer unnecessarily. So let us shift to the way that Carrie's touch implements the power of language. As Carrie's touch continues to challenge the status quo by empowering those who are historically silenced and marginalized, these terms are what we use to describe leadership key roles with the intention of being leaderful and a strength-based organization. We operate out of lack. We operate not out of lack, but out of the saucer, out of the overflow, as Reverend Tammie says. So when we talk about terms like visionary and implementer, these are terms that are very empowering. They're very inclusive. They bring the team together, operating in their gifts. Traditional terms can be very rigid, can be very individual, can be very self-aggrandizing. It can be very limited. It is not communal. So we use these terms to offer up community to not only to the internal team, but to ensure that that is shared with those Black women who are diagnosed with breast cancer, so that they too can be a part of the community and a part of this inclusive language. So for instance, our visionary sees the big picture and usually serves in what is traditionally known as the president. The visionary shares the vision with external and external shareholders while centering on breast cancer survivors for holistic healing. Our implementer, Aisha Ferguson, the implementer is one who organizes ideas, does calendaring, and actualizes ideas and concepts of the team in a strategic manner so that we are all operating under the mission and vision of Carrie's Touch. The integrator, who is Summer Hayes, the integrator is one who holds all of the forward-facing programs that align with the vision and mission of the organization. And let me just remind you that our mission is to save Black women. Our vision is to humanize the Black women's experience with breast cancer. The mobilizer, which is me, and Natalie summed it up in the introduction, I am considered the putty that keeps everything together by developing ports of communication, mission and vision alignment, and through task management. And our strategist, the strategist focuses on marketing, trends, analysis, because we need to make sure that we remain connected with the community. We need to see and make sure that we're reaching the community. What does our analytics look like on social media? Who's not on social media? How do we reach out to those who, when we talk about social determinants and talk about lack of access to internet, lack of access to good internet, lack of access to cable or whatever other information that's being fed to these communities. So our strategists make sure that we are connecting to those which we serve. So with that, I will end with this. The late Fannie Lou Hamer, who succumbed to the challenges of hypertension and breast cancer, said, "Nobody's free until everybody's free." So we center Black women, not for our own self-aggrandizement, but we center Black women and not decenter other groups and other cultures and other races. Because if a house is on fire, we are not going to go to the other houses first. We're going to address the house that is on fire and evacuate to make sure everybody is safe. So we operate in a both and model. An either or model is very centered in white supremacy. It's either this way, the only right way, the only way to do things. No, we are a both and model. So when Fannie Lou Hamer talks about nobody's free until everybody's free, we got to start with the 41% morbidity rate and moving that needle and starting to reduce that number. We have got to align that number with Black women being diagnosed less, but dying more. So until we are free, no one can be free in this healing process from breast cancer. The late Audre Lorde, who succumbed to the challenges of breast cancer after a 14-year process of healing stated, if I didn't define myself for myself, I would be crunched into other people's fantasies for me and eaten alive. This is why it's important for us to show up in policy making circles. This is why we need to be at the table when it's time to vote. This is why we need to be on the front lines when it's time to talk about legislative measures. This is why that my face, people that look like me, need to be in clinical trials. This is why we need to be on the forefront so that we can lift as we climb, as we are healing, as we are surviving, as we are thriving. So the power of language defines us, for us, by us. The power of language is rooted in divine power and not a false sense of self-aggrandizement, narcissism, egotistical, individualistic power over and oppressive acts. The charge today is to be the opposite of this power over and to become power with, and to join together with this community and beyond, to plug into a divine power that is within and with the Most High, and use our language to dispel the status quo of the invisibility of Black women, to insert our humanity into a narrative that often silences or ignores Black women, or even dismantling the system altogether because the system wasn't created for us to begin with, so that we might survive and build an egalitarian system for all. Thank you for this opportunity to share. I love you, Carrie's touch. Thank you for doing what you do. Keep doing it. I am because you are, and I am here thriving because of my community, because of my family, because of my children, because of my grandson, because of my village, and because of the power of language that speaks life into me every day. Thank you.
Oh, Reverend Dr. Davis, Tawana, you are speaking my language. You are speaking my language. I can't even begin to tell you how much. And so thank you, because I think I needed that. Not I think, I know I needed that. And a couple things I want to say. One is your mention of interdependence hit something deep for me, because we cannot do this absent that. And when we see disease, right? It has to do with the loss of that interdependence and our connectedness. The fact that we think that we can choose to be in relationship when in fact we are always in relationship. I think that piece about interdependence was just deep for me and resonated a great deal. And the other piece that I really appreciate is this idea around not ignoring identity, but rather valuing within a context of identity. Black womanhood is a wonderful, beautiful, meaningful, powerful thing. And so thank you for lifting that back up again. Thank you. So now I have the pleasure of introducing our panel. And I want to start with Tiara Neal. Tiara Neal is the Senior Vice President of Vexta Equity Alliance and the founder of Say Pink. He's a young breast cancer survivor who was diagnosed at the age of 33. Next, we have Caitlin, who is the Vice President of Carrie Communications Group, where she specializes in advocacy campaigns that engage individuals to drive policy change. And then we have April John, I'm sorry if I'm mispronouncing the last part, who is the Policy Director for the California COVID Justice Recovery, Response, and Repair Initiative. Whew, I bet you have been busy. In this position, she oversees the statewide steering committee and leads an integrated campaign that supports historically underinvested communities during and beyond the COVID-19 pandemic. And my question for you, I'm just going to ask you to take a few minutes to go ahead and talk about it, is what is the silver lining of your breast cancer diagnosis? What is that?
Yes, the silver lining of my breast cancer diagnosis is that it has catapulted me into a space that I could have never imagined I'd be in my life. You know, I used to produce television for BET, Discovery, TLC, and I was very content working in the space of television. Fast forward, you know, I was given the opportunity to to work with the company that I'm working with now, which is Sure Inc. And I'm overseeing the BEXA Equity Alliance, where I'm going into underserved populations and ensuring that women of color, specifically Black women, have access to early detection breast cancer. And, I could have never imagined this was what my life would, come to. But it's truly an honor. It's my purpose. People always talk about I'm praying for purpose, and I don't know what my purpose in life will be. And I read Purpose Driven Life so many times, and I've always been seeking my purpose. And at the age of 33, I was diagnosed. I am a young Black breast cancer survivor who had to advocate throughout my entire journey. I went to see for my yearly checkup, my gynecologist checkup. Woman's intuition. I asked my doctor, I said, can I have a physical breast exam? The ignorance of myself trying to physically give myself a breast exam every year was daunting. And again, I have no family history, healthy. I mean, all my friends make fun of me because I'm a juice cleanse freak. But she told me she was busy and that I was young and healthy and no family history, that I had nothing to worry about, and that she was busy, and she had a waiting room full of women who were pregnant, and those women were all Caucasian. It did not sit well with me. Again, just a moment of a woman's intuition that led me to, kind of sit with that a little bit. Left that appointment. 6 months later, I'm laying in my bed. I was feeling a lot of pain in my right breast, and I felt what felt like a little tiny rock pebble, and it was alarming. But again, no family history, 33 years old, healthy as can be. I made the decision to call a friend and ask for a referral for another doctor. Went to go see her. She said, no family history, the whole same story over and over again, but I will order you a mammogram and an ultrasound just to be sure. I went to go get my mammogram and my ultrasound, and, I think the lack of urgency is what was frightening to me as I'm going through this process, because again, I think the evidence is clear, specifically with Black women, because we're being diagnosed at an early age at increasingly rapid numbers. And there's no sense of urgency in this space, especially for young Black women. And, I went to get the mammogram and my sonogram. They could not give me a direct answer. They sent me to a breast surgeon, told me, no rush, no sense of urgency, go at your leisure. Me being who I am, advocating for myself in this space, and being a single mom to a young Black boy who worships me, loves me, adores me, and vice versa. I am just somebody who will always put myself and my son ahead of, and our health, at the forefront of everything. And I went to the breast surgeon, and she told me that I was going to have a biopsy. I was going under for an hour, and it would be an outpatient surgery. Mind you, I was highly confused because I thought I was completely fine. And now I'm having to have a biopsy, and having anesthesia was just not something I wanted to do. But nonetheless, I had the biopsy. She came out of the surgery and told me, it looks fine. I'm nothing to be worried or concerned about. A week later, she gives me a call and she says, this is shocking to me. This is shocking to me. No family history. You're 33. You're healthy. You have breast cancer. And in that moment, as a woman, as a mother, to Tammie's point, the first things you think about, am I going to die? Am I going to lose my hair? But to add on to that, I have a little boy, and he needs me. So I can't go anywhere. So what does that look like? Everything that doctor told me in that time when she was telling me about my cancer diagnosis, I heard absolutely nothing. All I could think about was my son. Fast forward, I opted to have a bilateral mastectomy, which I had several doctors, oncologists tell me I was young and and I was too young to make the decision to cut off my breast and that I should just have a lumpectomy. And I was silly for deciding to get a bilateral mastectomy. But in my eyes, I had to advocate because I didn't want to look up in 10 years and have to have cancer metastasize in my body. And then I'm fighting for my life. And I'm back in a space that is very uncomfortable and death knocking at the door. That is why I am here today, because it is an important conversation and we have to advocate for ourselves and for Black women.
You know, it's a good thing that I was on mute because I felt like I was having church because I think I must have said, yes, and so on and so forth. So I just want to make sure that I'm giving back to you that there's so much of your story that resonates across in a very personal way for me, certainly, and I think for a lot of other people. But there's also a usefulness in it. And I really appreciate you speaking about your self-advocacy, right? And just how important that was and the value that you placed on yourself in your own life. So just thank you for that and for sharing that and lifting it up.
Absolutely. Thank you.
Yeah. So next I am going to April. I'm going to call on you next. And we're so happy you're here. Thank you for being with us. And the question for you is, why is justice in public health necessary? Now, Steve, depending on what you say, I might need to borrow you for about 8 more meetings this week. Okay, because this is the constant conversation, but I want to hear you talk about this. Why is justice in public health necessary?
Such a huge question, Natalie, and I will do my best to try to set some context and framing for that answer, to provide a good answer. So, but before I get into the answer to this question, I wanted to just take a moment to say thank you to Reverend Tammie and Carrie's Touch for the opportunity to be in community with you all today. I also wanted to share that listening to your stories, brought up that I just lost my aunt to cancer last October. And that was a very difficult and challenging time for our family. So just watching her transition and her journey, I think to all of you all, it's an honor to be here with you all and listening to your stories, just having that intimate and personal relationship with someone who experienced cancer in that way. So thank you. So before I answer the question, I just want to make sure I share some context because that's always important. That's how I open up my conversations, because there's a lot of, as I think Natalie, you mentioned, there's a lot of history and context behind the answer to why are we even talking about achieving justice in public health, right? And so I think what we know, of course, is while we've made a lot of advances in public health, our public policies, our public institutions, and our systems, unfortunately, continue to perpetuate and repeat a history of oppression when it comes to policies. Right. And so this continues to create and perpetuate an unfair advantage for others and disadvantages for many. Right. And so let's look at COVID-19, for example. As mentioned, I run a statewide campaign that addresses COVID-19 and the inequities that it's laid bare. And so it's been widely stated, of course, I think this is preaching to the choir, that we know that our historically marginalized communities and vulnerable populations were disproportionately impacted by COVID-19. And we know that our systems were not prepared to respond to the emergent needs of these populations, right? And so if we're thinking about cancer patients, survivors, et cetera, from our hospitals reaching rapid capacity, leaving no alternative options to those with pre-existing conditions or even emergent conditions, right? So all of those things in collaboration kind of created this perfect storm for inequitable access to necessary care that these folks needed, right? And then also the mental and social challenges of physical distancing that we all faced added additional weight to those who were carrying pre-existing health conditions. Right. And so all of those things were directly connected to the inefficiencies with our public health systems. And of course, for many of us, this didn't come as a surprise, right? I see lots of heads nodding. And so I know that we're not shocked or surprised by this data. And so, I think it's important to set some additional framing around the importance of public health and what that even means before I answer the question of yes or no, is justice achievable? So when we think about our public health systems and think about COVID, our public health systems were supposed to be in place to respond to these issues. So we had, we have this existing infrastructure that's in place, that we kind of felt that, oh, okay, we're in a pandemic, we have, COVID-19, we have systems in place that are going to help this, right? And unfortunately, the answer to that was no. And a lot of that is because our public health systems are not equipped to address these issues that, Natalie, you mentioned, around equity, addressing issues of our vulnerable populations, ensuring that we're being responsive to their needs, and looking deeply at the challenges that are existing in our communities and making sure that our systems are equipped to respond to those needs, right? And so also when I think about justice, right, I'm thinking about, when we say justice in public health, I'm thinking about imagining a world and a system where there is fair treatment for everyone of all races, resulting in equitable opportunities and outcomes that becomes an actual reality, right? And not just something that we talk about. So this goes beyond equity. I know equity is a big trigger word. We use it all the time. But this is not just the absence of discrimination and inequities, right? So I often say that the structures that we create produce the outcomes that we see. So in order to achieve justice, we must both disrupt our existing oppressive systems while subsequently building deliberate systems and support that will achieve and sustain equity, right? So I say this like it's easy. It's not easy, right? As a Black woman, policy director in public health, this is incredibly hard but necessary work. And this is why I jumped on the opportunity to share my insights on this panel, because the next phase of our work will require that we all collectively understand the importance of public health, public policy, and how we can all engage, right? So back to the question, the original question. So is justice in public health possible? And my quick answer is yes. I think we are currently seeing a paradigm shift in how we're collectively engaging in public health advocacy efforts. We're not only seeing that we have more representation across the public health systems in our advocacy efforts at the state and local policy levels, but we're also seeing more engagement at the grassroots level, right? Which is why these conversations are super important. My good friend Melanie Richardson, shout out to her, always says, many hands make light work, right? And so I believe justice is possible, but this work will require many hands, right? So we need people from all walks of life, those who have personal lived experiences that can share and tell their stories, to people who are grassroots advocates who are lifting up the issues that our communities are facing, to people who have proximity and access to folks who are decision makers like myself, right? So taking these issues and making them translatable and transferable into policy, right? And I know that's a really big task, and I could talk about this topic for another 10 minutes, but I won't. But it will require us to continue to have more of these conversations, to engage and humanize policy, as this event is called. And I think from there, yes, we will be able to achieve justice in public health.
Oh, April. So I have a really quick follow-up question for you, because I'm curious. When the CDC set the vaccination requirements and they set them out in phases, and they talked about phase 1A, 1B, et cetera, one of the things that they did in phase 1B was to say people who were 75 and older. But we know that African Americans' life expectancy was 74.7 at about somewhere around there. So to be an elder and to be African American makes you younger than 75.
That's absolutely right.
Indigenous populations. How does that happen in the policymaking process?
Well, that's a very simple answer, right? The answer is that the people who are making these decisions, our systems, there is an absence of an ability to think from a race conscious perspective, mm-hmm. and also design policies that are designed with equity in mind, right? Mm-hmm. So we're talking about two things: race consciousness. So if you're race conscious, you're thinking about that life expectancy data, which my organization is currently doing some work around life expectancy data in California. which indicates that African Americans and Indigenous peoples life expectancy is around 74, 75 years old. So that data is very consistent across the country. So point being, if they're thinking about that from a race conscious perspective, then we design our vaccination standards around the life expectancy data, right? And then if we're thinking about equity, then we're thinking about the who, when, and where, right? So we're thinking about who should get these vaccinations first, at what age, where are people being most affected? So where's we have vulnerability indexes, we have all this data that we're not using to inform our decision making. So if we're looking at vulnerability indexes, then we can determine the where, and then we talk about the how and who needs to be included, right? So we think about our vulnerable populations of color, then we know that there is an innate mistrust in our systems that is rooted in history and lived experiences, right? And we don't need to go into the detail, but we know those factors are true. So we know that in response to COVID, as it pertains to vaccinations, we needed to make sure that there was a designed, implemented plan to engage our trusted messengers, who are our nonprofit organizations, who are our spokespersons, who are our epidemiologists in our communities that can really speak to our communities and ensure that they have the right information, right? That we're disrupting potentially harmful narratives and that we're dispelling myths around some of these issues. And so I think, again, race consciousness, equity-minded policies and responses are necessary, and which is why we haven't seen the results that we need to see in regards to pandemic response.
Got it. Thank you. Thank you very much. Very informative and helpful, I believe. So thanks for that. So next, we have Caitlin. And Caitlin, and I neglected to say your last name before, Caitlin Perry. So my apologies for that. Caitlin, why is it important to include voices in this justice conversation that are not Black voices?
Yeah, and thank you. And thank you again, as both Tiara and April already mentioned. It's, especially for me, it's just an honor and privilege to be here and to be able to work with Reverend Tammie and her team and to be able to speak to everyone today. And I think, that question to me has been answered multiple times just from listening to Reverend Dr. Tawana, to listening to Tiara, to listening to April Jean. It's not about an either or. It's not about lifting up specific individuals. It's about kind of the community. And to me, including voices that I don't have the experience that anyone else on this presentation does. What I do have the experience of is working within health policy advocacy and seeing firsthand prior to 2020, when so many other individuals started to really truly see the detriment of structural racism, not just in our society, but in health and in everything that touches an individual, is I was seeing that. I was fortunate and unfortunate to see that from my work working in public health, working in public policy. It was working on sickle cell disease in California and improving the life adherence rates and improving care for adults with sickle cell disease, because once you're past 18, they kind of throw you out into the world and say, try to find a provider who will treat you. What we then see is a lot of individuals going into the ER in a pain crisis and giving a bus token to go home. Why? Because they're not white. And it was in a Bleeding Disorder Act in Congress in the 1990s that every other bleeding disorder was included on improving access to care. What was the one left out? Sickle cell disease, because it impacts Black and Latino communities. And so being able to understand those from the front end, and then two, during 2020 and seeing all the unrest and seeing everything that finally was brought to the level of attention to where public officials were finally ready to take action, even though it had been decades, hundreds of years too late, is okay, now how do we center this conversation about what truly matters? And in truly matters is centering and humanizing, just like the conversation and just like the topic of this, is Black experiences. It's being able to know that if I went into the gynecologist like Tiara did, I would probably treat it very differently if I had asked for a physical breast exam. It would have been probably given to me in maybe 10 minutes, and that would have been that. But no, it took her how many times to just try to ask and receive a diagnosis. And it's each one of these stories rocks me to my core, because I know there are so many individuals that turn a blind eye and turn, because it's much easier to ignore than to address it, because addressing it, I'm able to say, yes, I understand my white privilege. Yes, I understand, but because of the color of my skin, I am afforded opportunities and benefits that a lot of individuals don't. But what can I do with this information? Instead of either bearing guilt and shame and trying to seek apologies from my friends and family, from community members, instead of walking every single day with that shame, it's choosing to address it in a way that I feel I can show up to the conversation. And the way I feel I can show up is how Reverend Tammie and I really began working with one another. It's because in my space, it's already about advocating. It's about, if we want to improve access to care for rare disease or rare disease communities, I work with patients with rare diseases to say, share your experience. Why? Because a lot of elected officials don't actually know the constituents that they're serving. They don't know the constituents that have rare diseases, that or in social determinants of health, and all of these that impact person's care. So when they're looking at health policy legislation, yeah, on the outside, it looks great because it says that it'll improve workforce shortages and all of these things. But in the legislation, is there any specific paragraphs that say it's going to improve workforce shortages and increase diversity within the racial workforce, within workforces? Is there anything to do with about truly going into these communities? Because it's not just about improving and creating policies that look good and sound good. And yeah, if we weren't structured in structural racism, yeah, those policies could probably benefit a whole lot of individuals. But to be able to truly create policies that benefit a lot of individuals, it's recognizing what has been already done to negate those experiences, to ignore those experiences, and to be able to show equity versus kind of this equality message. It's not just equality, it's equity. So everyone can be on the level playing field. And so we show up and rise up the communities that haven't, and being able to recognize, again, communities that have been existing like mine on this level of receiving the care, whether we wanted it or not, and being able to show what we can do to ensure that all of us as a whole receive equitable healthcare. Because again, and then it's easy from the economic side of things to say, yeah, it benefits everyone. It benefits the health insurance. They're not spending as much on crisis. They're saving money on prevention. And with that saved money, they can go better into the communities and truly improve care in those communities, in those rural deserts that we all know about. And try to truly, from a surround sound perspective, on putting policies in place that are truly with thought behind them and reason behind them, versus this this lip speak that we've all kind of seen since post 2020 of diversity, equity, inclusion, DEI, and everything they do. Great. We know a lot when we look into those plans of what they are proposing, and we know that none of that is truly going to move the needle. And so it's trying and choosing where we can truly move the needle. And it's working with Reverend Tammie and Carrie's touch on this 41% mortality rate. And it's atrocious that however many years have gone by, that Black women are still dying at 41% higher rates than white women. And what we can do, and we can truly move that needle, how? By sharing experiences, telling stories, and informing policy in an evidence-informed way, rather than this old-fashioned evidence-based research, evidence-based policy realm that we've all lived in, and the status quo that has existed for so long.
Wow, thank you, Caitlin. Much appreciated. And you know, it's interesting because I appreciate you lifting up the privilege within the context of your whiteness, because in privilege, whether it's being able-bodied, American-born, you know, you run the list, there's power, right? And so in privilege, and I like to lift this up for people of all identities, when you have privilege, it's like a hammer. You can either use it as a weapon or a tool. You're using yours as a tool. So I think that's just phenomenal. So thank you for that, and appreciate you lifting up even this evidence-based piece of the equation and how important that is. So I'm going to pause there. We have a few minutes that I want to open it up and ask, does anybody have any specific questions of the panelists? Ricky says, we have so much to do to change the game here. Where is the best way to start? So much to do to change what's happening. What's the best place to start? Hi, Ricky, I see you. Thanks for being on. Do you want to provide any more context for that?
So, you know, we have we're all in this fight together. I so applaud these young women who are dealing with this issue that we see every day. I just got off the phone before I got on this call with a woman who was 38, had the same situation as you, Tiara, had to fight for her care. And she's stage 3, her too. And it took her 2 years to get a mammogram. And now she feels like she was like, you know, and she blames on the fact that she's young and she's also on Medicare and didn't have the money to spend on her own mammogram. So I just feel like, you know, the one thing that we're trying to do is our HBCU internship program. But like last year we had 15 kids. This year I'm hoping we can get 25, but that's still such a drop in the bucket of teaching young women. So, I mean, I think we all can do this, but, you know, we're all preaching to the choir and we're all dealing with this. So how do we get to the non-choir? Like this poor little girl I just talked to, you know, she isn't really in a Facebook group. She has no one to turn to and wants to get a second opinion. So I'm sorry, my son-in-law is coming to pick up my granddaughter. But I just feel like I don't know how we get more tentacles into our community. And I think the more we do, and I know you guys are doing it in every way possible, but we need more of us and more stories and more town halls and more, you know, access to people. So I don't know what the answer is. I wish I knew.
Thank you, Ricky. Does anybody on the panel, do you have any thoughts about that? Where to start? Tiara, go ahead.
Yes, I just want to chime in and say, you know, to your point, Ricky, I think the biggest challenge here that needs to be addressed is Black women need to start being screened at an earlier age. I think, you know, 35 women of color, specifically Black women, need to start being screened. So we need to start those conversations now to ensure that when, you know, Black women are educating themselves at a much younger age in their 20s, because listen, I had absolutely no idea what this process looked like. Breast cancer was so foreign. I might have worn pink in October, and that was the extent of it. And that is me being completely honest. I had to quickly educate myself in a hurry as soon as I found out I was diagnosed. And I think starting the conversations earlier will help us move the needle just a little bit more forward, and allowing everyone and educating women and educating really everyone, and reminding them that Black women need to be screened at an earlier age than what we are screening. And the mammograms are not covered, to Ricky's point, until you know, you get a diagnosis at a younger age, which that leads to a lot of complications, especially if you don't have access to good health care.
Thank you, Tiara. Preventable, avoidable, unjust, right?
Yeah.
So when we think about policy and practice, what you're describing is something, and what Ricky is describing are things that are actually preventable and avoidable and unjust. So thank you for that.
Yeah. We're actually doing a meeting. We got a congressional meeting on March 3rd on Triple Negative Day at 8:30 with Congressman Bonnie Watson Coleman from New Jersey. And so she heads up the Congressional Black Caucus, or whatever, Council for Young Women or Women. And so I would love for you guys to come and join us. I'll send you the flyer. We just got it confirmed, but the more people we can have show up there, the better. We also have been talking to Congressman Robin Kelly from Illinois. She has, and she just introduced a bill on clinical trial diversity. So I think the more we can get in front of Congress, the better, to kind of get these rules changed, not only on when you get your first mammogram and when you get screened, but also on clinical trial participation and really all the things that we need. So I hear you on the legislative thing. I just think, you know, the more we can show up, the better, you know, so.
Thanks, Ricky. Appreciate that. And we'll make sure after the fact that information is shared so that others can join in and participate as well. So thanks so much for that.
And join our When We Trial movement. I have to say that right, Tammie. whenwetrial.org.
Thank you, Ricky. Just send me a whole email and we'll make sure we share it. I love you and I appreciate the work you're doing.
I love you too, my sister. We got to do it. We got to get you done.
We're in this together. Let's keep moving.
Thanks, everyone. So we are about to get ready to move on to our next speaker. So I just, again, would like to thank all of the panelists for your thoughts, your ideas, your work, your passion and your commitment, and how you showed up today and how you're showing up every day, because it is making a difference. So again, thank you for that. Now I have the privilege of introducing Representative London Lamar, who is currently the representative of District 91 in Shelby County, Tennessee. She is the youngest female legislator in the current 112th Tennessee General Assembly. She serves as Secretary of the House Democratic Caucus and Chair of the Shelby County Delegation of State Legislators. She currently sits on the notable Finance, Ways and Means, and Criminal Justice Committees. She's passed 10 pieces of legislation in the State House and 6 are public laws. So with that, I'm going to hand off to Representative Lamar. We're so happy that you were able to make time to join us during a busy period for you. Thank you.
No problem. Thank you so much for inviting me to speak with you all today. I'm really excited to be here. I'm Representative London Lamar. I represent the 91st District, which is located in Memphis, Tennessee, but I serve here in Nashville at the state capitol. And so this panel was really, really important to me because when I ran for office, I promised that I would stand for 3 things: strong schools, healthy families, and safe communities. And a healthy families thing is really, really important for me because in order for us to have thriving communities, we have to make sure that everyone is healthy. And I'm not just talking about physically, I'm talking about mentally, emotionally, and economically healthy. But let's talk about this physical piece. When I think about all the work that I've done, the work that I've done centers around women's healthcare and making sure that we have all the necessary resources and support that we need in order to live happy, healthy lives throughout the duration of our womanhood. And that's just not talking about birthing and maternal healthcare, which is I focus a lot of my energy on. That means what are we doing to care for ourselves at the later half of our lives? My first experience of really dealing with women's healthcare, especially specifically breast cancer, was when I was young. I remember when I was in the 4th grade, 2 months after my grandfather died, my grandmother was diagnosed with cancer, breast cancer. And she had to get a mastectomy in the breast that was infected. And I had to see her go through that whole process from finding out the news to going through surgery to going to each and every one of her chemo treatments with her as a young child. And I remember her brother would take her because my grandfather is now dead. And he would take us to Burger King to wait while she goes to the back. So we'll sit in that room, the waiting room. I used to look forward to the Burger King meal, and then we'll come back and we would pick up my grandmother, who would then have to sleep all day, and I would have to support her as she was going through chemotherapy. And from then on, it was my real example as a 4th grader of understanding that breast cancer is a real issue and it's impacting families like mine. And so seeing my grandmother go through that process made me realize that we have a whole totality of issues we have to focus on when it comes to women's health care. And oftentimes we focus on the issues that happen to us earlier in life instead of the ones that's later in life. And so I wanted to do something about that as a legislator. And so with Senator Gilmore last year, I passed a bill into law that will require female inmates who are 50 through 74 years old to be offered a mammogram or other appropriate screenings every 2 years. And it will require female inmates who are 40 to 49 years old be offered physician consultations to inquire when a mammogram is needed. Look, I can't solve all issues, but I know there was a vulnerable population that was being left out of the conversation around women's healthcare and breast cancer awareness. And that was our female inmates. And unfortunately, female inmates are a rising population here in Tennessee, where our biggest departmental budget is corrections. And so for me, what does that do? And well, in practice, I saw a lot of people talk about policy and things like that. Well, it was a policy to potentially offer these women, but with my bill, I codified it and made it mandatory that our female correctional facilities have to offer these services to female inmates. And what that is starting to set the tone that even from our most vulnerable populations that are oftentimes left out about to our most privileged populations, breast cancer awareness is something that we should always be thinking about. And even for myself, knowing that my grandmother survived breast cancer, and we've heard the rumor it skips a generation. Well, that's me. I had a friend in her 30s who had breast cancer. So it's also making me think that I need to go start getting mammograms very soon because there's a history of breast cancer in my family. And so as a woman, I take it seriously because I've seen what it could do to a family. I've lived through it, but also as a legislator, I've made it my priority to ensure that I'm advocating for women's health care and pushing policies that's going to demand and put stipulations in place to ensure that our government agencies are providing healthcare services to women that includes mammograms and other breast screening. So I will put a pin there and just talk, and that was some of the things that I've been working on, but I'll open the floor to about questions about some of the work that I'm doing as a legislator around women's healthcare and how we can further those initiatives.
Thank you so much for that, Representative Lamar, and for the work that you're doing. It's so important. Your voice, and you're carrying the voices of thousands of people with you when you speak. So thank you for that. Does anybody have a question or a comment for Representative Lamar? Anything that stands out for you? Anything you're curious about in the policymaking process in terms of what she has learned or what she faces? Atiba? You're unmuted, so I didn't know if you had something.
Am I unmuted? Hey, Representative Lamar. Can you
Hey.
hear me? Hey.
Yes, I can hear you.
Great. I guess I'll ask you, you were first off in the state of Tennessee, but also you're part of the National Black Caucus of state legislators. And so when you look at, this issue, what are some of the things that constituents in your states and your districts can be doing to help you all to better educate you on these types of issues, but what also can be done from a legislative standpoint in terms of building your relationships with constituents so that they can best meet those needs, both within their districts and from a national standpoint, to be able to push this in the state legislatures and within Congress?
Absolutely, that's a good question. So I'll take it one at a time. For the most part, I think that it's important for me to continue to put information out there that I am working on these issues so that people in my district know that I'm a resource in order to further many of the policy initiatives and or the grassroots community issues and programming around breast cancer awareness. That's also including lifting up breast cancer advocacy organizations around breast cancer awareness and include them in the work that we're doing so they can connect the policy work that I'm doing to the on the ground people who are really needed support around these issues. And if we can continue to make a strategy around connecting all of these stakeholders and around breast cancer awareness and pushing policies around breast cancer, then as people go to the polls, they know they are voting for an advocate for breast cancer when they see myself in the work that we're doing. Also making sure that I take it upon myself to get directly involved with organizations that are doing the work on the ground around education and advocacy around breast cancer. Also donating to organizations that are doing work to educate women and give them resources and support around breast cancer, whether it's getting your mammograms, whether it's learning how to do at-home checks, or just simply educating people in the community, and also including these organizations in my community events as I go around the city hosting educational opportunities for constituents. And also we want to make sure our constituents are supporting legislation that is going to further more support and initiatives around women's health care, and make sure they're taking part by emailing, coming to the Capitol, and having conversations with their elected officials about why they need to be supporting more legislation and policies around breast cancer awareness.
And that leads me into one other question, because often what happens is, and I know for myself, before I became really engaged in public policy and working with state legislators, the idea of sending a letter, you often think, oh, it's just going to end up in a pile. The idea of making a phone call, you feel like you maybe just end up getting an answering machine. What kind of impact, when you do receive a letter or an email, or a constituent calls your office and you hear about that, how does that impact you, and what have been some of the best ways? And I know you do a really great job of using social media to talk about what you're doing, but what are some of the things that you've seen from your constituents and from other advocates that has really worked to be able to get onto your radar about these issues?
Well, I will have to say that social media is probably the best way to get to anybody, because no one likes to be embarrassed on the internet or going to the news. So if you're doing a press conference on me or you attacking me on the internet, then you're probably going to get my attention. One, because I'm probably going to be very upset. But two, I know that the reach is going to be further. Or I'm always checking my Instagram. Like I tell people, send me an Instagram message before an email, you receive it there. That's what works for me. But yes, I do look at my emails every day. Like there's a particular issue that I've gotten like 4 questions. excuse me, it has to be maybe over 15 different emails about this one particular piece of legislation. And now I paid attention and went to look up what the piece of legislation is. And while I don't agree with the legislation, it's not changing my mind. I know that if I don't vote for this, then there's going to be some potential backlash for not supporting. It's just so happened it's one of those issues where my community, which is a Black community, is not going to get on board with this issue anyway. So I will still be okay, but I know it's coming. And that's something I'm preparing myself to fight against, as I know is rolling. And it has a lot of support, which to me, if I'm not supportive of it, that means I have to prepare to fight it. Which means I can also galvanize my base around it. So a lot of times, for example, there was a critical race theory bill that just got killed today that was trying to come through. If I'm not mistaken, it was like something with education and colleges. Well, it's died, and I'm glad it's dead, because if it made it through this subcommittee, then I was going to go to my basic constituents and tell them, I need you to help me shut this bill down. So emails and reaching out can have either or effect. I can send out a bunch of emails and it cause someone to galvanize more support, or it can do the opposite effect depending on if they're not going to change your mind or at all. Also, the other most effective way, and I tell everyone to get your voices out there and use media. Free earned media is the best way to get information out there. I love to send the initiatives I'm working on to MSNBC, BNC, local news stations, op-eds, whatever media piece I can use to get my name out there, because it's free and it has a very widespread audience that I could get both local, regional, and national, just depending on how far I want it to go. So I personally utilize those things. And if somebody's trying to get something done and they really want me to pay attention, you're going to have to go to the media. But most times it doesn't necessarily take all of that, because you send me a social media message or something like that, and I'm seeing consistency around your advocacy and your engagement, and then I'm paying attention. And most importantly, do not underestimate the value of showing up in person. Now, while I say social media, that means a lot, but understand that's because I'm young. Most of my colleagues are not. It is what it is. You're going to have to show up to their office, in their doorstep, in their faces, to take them seriously. It doesn't necessarily require all of that for me, but for others, it does. And so I don't want you all to think that my way of a simplified form of engagement is the way that every elected official works. It is not. Every elected official has their own way of how they pay attention to issues, how they engage, and how they take it seriously. And then furthermore, I've started something where I've been doing similar legislation with colleagues throughout the region, like us, introducing matching legislation or matching initiatives or programming in our areas, to also making sure that we're expanding our needs and our initiatives regionally in the South. Because one thing you do notice about politics is that regions oftentimes have some of the similar ideologies. Like people in the South kind of have a very much more conservative, where people in the West and the Northeast are oftentimes like more progressive, and the Midwest is kind of in the middle, more moderates. And so I oftentimes like tailor my issues based on what demographics I'm working on. So make sure your conversations with legislators in California is going to be completely different than legislators in Tennessee, Black or Democrat. Like, we're conservative Democrats in the South versus y'all are super progressive in California. That's just not who we are. And so you also got to make sure that you are specifying how you want to attack these issues based on who your audience is. So be very careful about that as well.
Yeah, I'll turn this back over to Natalie, just with ending it that all politics are local. And I also just want to commend you too, Representative Lamar, for the fact that you've been able to get legislation passed in Tennessee, where we know that while you have that conservative base, but you have Tennessee is a very red state. So being able to do that means also being able to cross party lines to be able to get that support.
Absolutely. And I'm very strategic. And I think that's a great thing about breast cancer awareness, is that it's no color lines to breast cancer awareness. There's no political lines or political party lines. All women suffer from breast cancer. So there's a way to galvanize everyone around your issue and get that bipartisan support, that diversity and racial support around, because it's an issue that affects all women. So I do think it's very strategic for you all to be able to get support around this, even though I think that Black women are suffering more. But oftentimes, like, for example, what I do with my maternal health care, and as a reproductive justice advocate, I don't champion abortion issues. I champion maternal health issues because I like to challenge the Republicans on their ideas of pro-life. So if you are pro-life, then I'm pretty sure you want to be pro-mothers. And I would challenge that same ideology on women's health care. If we're pro-life, then let's be pro-life about the duration of all women, not just when we're trying to have a baby. What happens down the line, we in our 40s, 50s, 60s, 70s, and we got to be for the lives of ourselves when it comes to mammograms, breast cancer support, and all the other women's health issues that truly stem from having kids in the first place. So, oftentimes when you're working in states like mine that seem like they won't be supportive on the outside around your issues, challenge their morals and attack their moral standings with the issues that you are pushing.
Representative Lamar, I just have to jump in here and thank you so very much I was trying to take notes, but you are such a powerhouse. I had to just stay forward facing and engaged. And I look forward to the opportunity for Carrie's Touch to continue to work with you on developing legislation. And yes, we are a lot more relaxed here in California than some of y'all are in the South. And
I'm jealous though.
But listen, sis, you're rocking your braids. I'm just going to say a thing. And I got the memo to wear green. So, we rocking our red, black, and green. That's all
I know. That's right.
But, I love what you bring to this conversation, and I love your youth, right? And I love your perspective around it. I think I was just being diagnosed. You're not even old enough for when I was at any rate. I thank you for the conversation, your commitment to change, and your will. I started my comments today talking about the courage to stand for change. And thank you for the courage that you have displayed throughout your tenure, and you will continue. You got a long career ahead of you, and I look forward to just partnering with you and learning and growing together.
Thank you. You too. I'm just so appreciative of the work that you're doing. All the work that you and the ladies are doing is so important. It impacts families like mine, no matter where we are in this country. I think we can all galvanize around more support for women's healthcare. And, God bless you and the work that you and these amazing sisters on this call are doing. And I look forward to continuing to help champion the work as we go forth.
Wonderful. Thank you for taking the time to join us today.
Thank you, Representative Lamar. I have the pleasure of introducing Atiba, who I've known for longer than I care to admit, because again, it would be an admission of my age. So we will just say that we've known each other for a very long time and for a lot of very good reasons. Atiba Madyun is president of the Madyun Group and a political contributor for the Black News Channel. He works with Carrie's Touch on public policy. I could say so much more, but I won't, because I'm gonna go ahead and hand it off to Atiba.
Well, thank you very, very much. And thank you for keeping that introduction brief, because I would hate to go into how many years, Natalie, we have known each other. But well, first of all, I just want to thank you for moderating this, and then for Reverend Tammie for having this platform and this organization and this conversation, and then the team that has put this together. And those of you who are out here who are joining this call today, because this intimate conversation, it's not just that it's important, it's necessary. And the title that we have this with Humanizing Policy, and I'm going to talk a bit about that, but I'm going to talk about it in some ways that some people might call me incorrect. And I say that because unless you're under a rock, you know that a few weeks ago, the United States Congress voted down or denied the Senate an opportunity to vote to protect the one basic element of a democracy that is the most important element, and that's voting rights. So I often ask my clients, particularly who are white, this real question: how are we to get systemic change if we cannot get elected officials to protect that one basic element of the protection of the right to vote? Something that men and women and children walked across the Edmund Pettus Bridge and literally almost died. John Lewis, we know, he was an incredible human being who advocated for the right to vote. And he always was urging us to do what's right behind me. And the reason why I have that behind me whenever I'm on television is because I want people to see that almost as their vision board to vote. And why is voting so important? Not only is it the most important part and a systemic part of our society, but our inability to vote is what made it possible for slavery to exist. Our inability to vote was what made segregation last as long as it did. And our inability to vote is also what made and continues to make mass incarceration happen. We often talk about things like social injustice, and today we're talking about breast cancer in Black women. The social injustice, the root of it is blended into this idea that power over, as we heard earlier, as Reverend Tawana said, as we've heard Natalie talk about equity, diversity, and inclusion. And when we talk about breast cancer in women, telling of the story of Black women is more important now than ever, because as Reverend Tammie has often said, and that I find myself continuously repeating, is that this 41% morbidity rate, not only is it real, but we haven't moved the needle in over 20 years. So we see the Senate already opposed to a Black woman being appointed to the Supreme Court, even before the president has appointed or nominated someone to the court. And I believe that a lot of that is because Black women have always been and always will be the moral compass of America. When we hear people talk about on the other side, and I say the other side, assuming that most of us are at least want to see this become a more perfect union, regardless of what your political affiliation is. But when we hear terms like the Republicans talking about sex trafficking, for me personally, I can't help but say, you all were the first ones to do sex trafficking. What do you think the slave trade was? When you went and got Black women, brought them to America, made them slaves, raped them, ripped their children from their arms, pushed Black men out of the beds. These are real stories, and I'm very intentional and direct about saying these things, whether and that makes someone feel uncomfortable, because it's just the truth. Black women in America were the last to be given the right to vote. And some might say, well, later on, Black men and women were given the right to vote, but here's the reality. Black men were given the right to vote after slavery, even before white women were given the right to vote. Children have been ripped from the arms from Black women from the inception of this country and still are. So when we talk about social injustice, then and now we still see through mass incarceration, through police officers killing children, that this is still going on. So I'll say this, yes, I'm on television and I get to talk about a lot of different issues. But one of the things that I'm often charged with talking about is dehumanizing the stories of victims. But the real question here is, why do any of us have to talk about humanizing ourselves? Because when you see someone who's white who's been killed, we don't hear the stories, and I don't talk about this on television, about the need to humanize that person. But so what does that mean? That there is an accepted premise that we as Blacks and Black women, and as we talk about breast cancer, are not considered human. And I think that is part of the greater discussion that we're talking about. So when we're talking about telling the stories, I have to say that Reverend Tawana has helped me really understand the need to be direct in our communication. So this is what I'm gonna do in terms of being direct in my communication about this. Is there a need to tell the story of Black women and breast cancer? Absolutely. But there is a greater need to change and open the hearts of those. And I think that Caitlin did an excellent job in terms of talking about this from her standpoint as a white woman, when she talked about the fact that if she went to the doctor, she would not have had to go through the same thing as Tiara went through. When you hear the story, for instance, of Reverend Tammie talking about why Carrie's touch came to be, and when I see and hear and see for myself how my mother has been impacted by her relationship, both with Reverend Tammie and Carrie's touch, and when I continue to hear stories like Tiara's, it makes me want to get more of men involved in this, because we have to be doing the work first, not just of humanizing Black women in this discussion. When we talk about policy, yes, about humanization, but the bottom line is it's about not being invisible anymore. It's about walking into an office, and because the 41% morbidity rate, as was said earlier, is there, that we are the burning house, and that house, that fire should be put out first. So what we're doing, or what we're looking at doing now with Tammie's Touch, and where you're going to see these next intimate conversations go, is really delve into how do we address policy? How do we identify and talk to people like Representative London Lamar, who are right there on the front lines doing this work to get policy introduced and to get it passed? And how do we engage all together to push this policy through social media, through earned media, through phone calls, through actual visits to the capitals across the cities, across the states? Because in the end, really, all politics are local and all people affect change. And what we can do, and we will do, is do that together by not just humanizing policy, but having policy enacted that addresses the human conditions that we continue to see, and the reason why this needle has not moved with the 41% morbidity rate between Black women and white women.
So Atiba, thank you for that. And I do have a question for you. As I listen to you talk, I wonder, what gives you hope about the movement of policy in a direction that makes health equity a reality for Black women? What do you see in the landscape that gives you hope that maybe you didn't necessarily feel in the same way 5 years ago?
Every morning I get to wake up and see the sunrise. And I say that sincerely. That gives me hope, because every day that we're living, there's a chance. And we can't ever give up that chance. I often think that we do, and I'm not talking about Black women, I'm just talking about we as a society, we do a lot of complaining and not enough doing. One of the things I will say about Carrie's Touch is there are things that you won't hear in these intimate conversations. You have to really become more engaged with this organization, and organizations like yours, Natalie, Common Health Action. And I say that from the standpoint because there's so much work that's being done, but there's so much that more can be done by engaging and getting more of us together. So I try to speak more so from a position of hope, of a place of hope, than about fear. To get a diagnosis, I don't know what that is like, but to see my mother get a diagnosis and be in the doctor's office and literally cry, that's real. But the hope was, as Reverend Tammie again helped me understand, I used to say, well, it bothered me to pick my mother up and take her for chemo treatment, to know that she was going to get sick after that treatment. And as Reverend Tammie said, but the thing was, Atiba, you weren't taking her to get sick, you were taking her there to get better, which is why now, 7 years later, she's still here and she's still able to be with her grandchildren and her great-grandchild. That's hope. And so the women that continue to be touched with Carrie's Touch and other organizations that are touching and helping Black women, that's hope. But how do we get this policy enacted? That's the hard part. And someone who works in public policy, I can tell you, it's not easy. And one of the things that I'm hoping to bring to this conversation is the fact that you may not win the first go round. Doesn't mean that you don't go back and try it again. And it doesn't mean if you lose the next one, you don't try again. That's why I thought that London's presentation today was so great, to talk about being in Tennessee, in a red state where you would think that a Democrat can't get anything done, but she is getting things done. And so we collectively have to come together. We collectively have to go from here, and hopefully everyone who's on this call today will go back and bring 5 more people to the next one, because we got to keep going. So I'm just going to put it this: we talk about hope. John Lewis taught me so much. And I had a 3-hour conversation with him when he talked about what it was like to start a movement. And he said, the thing was that we sometimes had these meetings and there would only be 2 or 3 people in the room, but we didn't stop. He said we kept doing the work. And then the next meeting, there might be 10 people there, but we kept doing the work. And then eventually there was 50 people there. And then there were thousands, and we were walking across a bridge, locking hands, singing, "We Shall Overcome." But what he said was, that's how you create a movement. And that's what we have to do. And that's the hope. It's like, even when people keep talking about voting and them trying to strip us of our vote, they can't strip us of anything if we are willing to do the work to fight. And that's what I see that's in this breast cancer, Black women discussion. And what we also need to do, and if you ask me, where do I find the hope? I do believe that the hope is also when we are able to bring more men to this conversation, because they're the husbands, they're the fathers. Some of them are breast cancer survivors, some of them have breast cancer, but bringing them also to this conversation that's how we really get and push this agenda forward.
I really appreciate that, and especially you sharing the part about Representative Lewis, because I think you're talking about the difference between evolutionary and revolutionary change, right? And this idea of setting expectations and recognizing that policy change is generally about evolution, which means it's for the long haul. And often the things that we're doing today are seed planting for fruit that will bear that we may not even be here to see. And so I think that's a really important point about sort of the tenacity and the willingness to play the long game, for lack of a better way of playing, talking about it as it relates to policy. The other things that I'm hearing you talk about a little bit has to do with narrative and network. There are these two components in this policy piece, and I'm curious before we move on, do you have any thoughts about the narrative around Black women and breast cancer that you think needs to be out in the world right now?
I think women who are doing this work, like Reverend Tammie, already have been doing that. And I'm somebody who works behind the scenes on political campaigns to get people elected. And the hardest thing to get an elected or a candidate, particularly a new candidate, to do, stay on message. Because often they feel like that message is not resonating because they're not getting the media hits that they want to. But if you keep saying the same thing over and over and over again, I can guarantee you that people, when they see me, are going to keep saying something about Atiba. What I keep saying, this intimate conversations. I keep saying this thing Carrie's touch. You keep saying the same thing over and over again. The morbidity rate between Black women and white women is 41%, and it has not changed in over 20 years. You keep saying the same thing over and over again, people, like a commercial you see on television, are going to start repeating that themselves. And so, that's the message that I have. Have a simple message. And what I always tell candidates, and when I tell people who are working on these type of things, is that the hardest thing is to get other people to repeat. The easiest thing is to keep repeating what you're saying, because that hard part will come about. They will start to repeat what you're saying, but you've got to say it in a way that is easily digestible,
right,
as well as easily repeatable. And that is something that is easily digestible and repeatable.
Thank you for that, Atiba. Reverend Tammie, did you have anything you wanted to say before I move on to frame the breakouts? If not, it's okay. Just wanted to open it for you.
Oh, well, thank you. First of all, thank you, Atiba. And thank you for illuminating the voices of men. And I agree with you wholeheartedly that it is necessary for us to incorporate men into this conversation in a spotlighted way. I don't want it to seem like men are excluded. They've always been invited to the table, but we want to bring their voices forward as we move forward. And I had in my notes to say a little bit later how, just kind of the synergy between Natalie, myself, and Tawana having very similar opening presentations. And, at first I was like, oh no. But then I was like, you know what? Repetition is the mother of mastery. And the more times people hear it and the more people that say it, it'll resonate. Ricky was very poignant when she said, we're preaching to the choir, but I don't minimize the choir that we preach into, because there are people on this call that have never been on the call with us before. And so while they may be part of a choir, they've never been a part of this choir. So you still have to fine tune and get the harmonies together in order to make a melodious sound. And I feel like that's what we are moving toward and what we're doing. And Atiba, I appreciate and celebrate you as a man and as a Black man to unapologetically acknowledge your love for your mother and the impact journeying with her had on you personally and emotionally, and giving yourself space, grace, and permission to cry. So thank you for showing up in your full authenticity. And I just look forward to getting into these groups and small groups and unpacking this dialogue a little bit more. Thank you, Natalie.
All right. So we're glad that you stuck around to be able to be a part of this. And I am going to turn it over to our tech wizard, Olivia, and she's going to send you all out into your breakouts. Welcome back. I am hoping that you all had some time to connect and to share some ideas and to explore a little bit. Now, understanding, of course, that if you got through all four of your questions, y'all were doing big things. So I'm going to work on the operating premise that that is not what happened. But I will open it up by saying, let me ask, why have you or haven't you engaged in the policymaking process was the first question. And I'm curious about whether anybody would be interested in sharing their response to that question. If you have, why have you and how have you? And if you haven't, why haven't you? And maybe what might it take for you to do that? So if you're interested in commenting on that or sharing what you talked about a little bit, feel free to unmute yourself. I'll see you and call on you.
I think Courtney Quinn should answer that question.
So
That's being voluntold, Courtney.
Hey, totally fine. I have a feeling, a few of us have been called out by Tammie as well. So, but no, I'm joking. My name is Courtney Quinn. I am a breast cancer survivor, and I am the executive director of All Be Aware Breast Cancer Foundation in Sacramento. And I am new to the organization as of the end of August of last year.
Oh.
So that is part of the reason our organization is also changing, where it had not been as involved in policy. But now that I'm here as a breast cancer survivor, I'm seeing changes that we need to be making. And then because we're also based in the state capital of Sacramento, we have some board members that are also involved either in the past or currently in legislative roles. And so we are going to be engaging more. We've been engaging some with Perry Communications on some pieces. And then we're doing a deep dive on research right now that we hope to be bringing an issue back to engage Tammie with and others to make some changes on the state level too.
Fantastic, thank you. Okay, Tammie, so you might have been right about that one. Thanks for that. Anybody else? Why you have or haven't engaged in the policy making process? And if you're compelled, it's great. And if not, it's okay. And I'll move on to the next one. Anything pop up from your conversations? All right. Oh, Charmaine, hi. And I get to see you. Go ahead.
We just touched on it a little bit. I was sharing with Ms. Tawana that, the policies around here are really, it's a difficult policy that they have in place for women to be screened or to be tested. And I am in the battlefield trying to make some changes about that, because we have so many hoops we have to jump through to just get a test to see if we are positive for cancer or not. I was sharing with her, like, COVID just came on the scenes, but you can get a test almost on every corner. HIV was on the rise, and you can go, every clinic is free. And same thing with STDs. You could go get a test so freely, but with cancer, it's been around for years. Why do we have to go to our primary care to be referred to an oncologist, and then the oncologist sent us to a imaging center? So it's just all these steps to be screened.
Mm-hmm.
And this is such a serious epidemic for Black women.
Mm-hmm. Mm-hmm. Mm-hmm.
We 41%. And it's like really ringing home, like, this is not something that should wait till we're 60 or 70%. We need to be jumping on it now. And there needs to be gateways or remove the barriers that are causing us to not be able to get in there more frequently and more easily to be tested, so that we can reduce these numbers. I mean, that's been my barrier, trying to get women to get screened, and then the ones who are or they've gotten their diagnosis too late.
Right.
So it's just been a battle. So, and then with our untrust of the system. So.
Got it. And I think that's an important piece to lift up. Thank you for that, Charmaine. So what did you learn today about engaging in policy, or what did you think about today with regard to engaging in policy that maybe was a new thought for you or a new idea? What was something that you learned about this whole policy thing maybe that stands out for you? Charmaine, go ahead.
Well, this whole thing has inspired my work. I was almost ready to give up. And I mean this wholeheartedly, because it's been a challenge talking to my own kind about this serious subject, and they're so resistant. Some are really open and want to share everything, but it's very few. And some are have a brick wall up because of all the barriers and the challenges and the trauma that they faced in their own lives. So just within my own community, which is a very high rate of cancer women, African women, cancer women, it's been a challenge trying to talk to them and get them to open up and come and receive services and just to love on themselves and get the help that's out there. It's almost like they don't believe that it's out there, or they're shutting down because, like I said, they don't really understand. But what I've learned today is that it takes the village, like Ms. Tawana said, it takes us all to keep encouraging them on how to live. You know, they may think it's a stop sign and this is it, and I have to be right there to help them and keep encouraging them to keep going, you know, and live the best life they possibly can. And through our program, we offer fresh vegetables and massages and acupuncture. All this is free for the ladies. So I have to keep pushing them to come out and love on themselves, and to, you know, keep working with the hospital Zuckerberg and the San Francisco Cancer Women's Network and San Francisco Health Plan to make these changes. Like, we are all talking about it, but I don't see us resolving the issues around making these changes. So I'm going to stay at the table. I'm going to stay in this in the fight and trying to get us to keep talking about how we can remove these barriers so that women can get in and get screened and reduce the numbers as best I can. So that's what I learned today, that I have to stay in the fight.
Well, Charmaine, thank you for that. And I have a follow-up question for you, because I can't help myself but to ask. You know, whenever I encounter people like you who are frontline folks and making the difference on the ground, I always have to ask the question, what do you need? Because sometimes when you say what you need in front of a group like this, they may not be able to do it today, but they will remember you. And maybe there is a way that something can find its way back to you to support you and lift you up and to reinforce you in those moments where you're feeling like, I can't do this, right? So what do you need to keep doing?
I think I need to stay connected to y'all. That's one thing. I needed, like I said, I'm home today, and I needed a self-care day for myself. I wasn't feeling 100 and I didn't feel supported at work. So I just need to stay around people like-minded, who want to keep doing this, who really enjoy doing this, and, you know, have a passion for helping people. So if I keep myself in the realm of people doing this work that are positive about doing this work, I will be okay. I think I just need to stay supported in that. And even if I'm not getting it out of my circle, reach out to people who are still like-minded and doing this work. I'll be okay.
Without question, you deserve that support. So I'm glad that you lifted it up and actually said it so that people could hear it. That's part of being in community, right? And this is an amazing community. So thank you so much for being willing to share that. Is there anybody who was missing from today's conversation that you think it's important to include their voice in the future? Who else can add value here? Charmaine?
My supervisor. My supervisor needs to hear this. I want to send her this whole video. Well, y'all have to send me this video because she needs to see this. She definitely needs to see it.
That sounds good.
I think she'll be moved by it.
That sounds good.
And the San Francisco Women's Cancer Network, they need to see this. This was awesome. They talk about you all and they don't even know you. So you just don't know. Like, we are really in the field working for Black women with cancer and trying to really make change. And just being here in this circle with you all has been very inspiring. I can't say it enough. Like, it was just what I needed at the right time. And I was sharing with Ms. Tawana, it's like, you know, when you don't want to go to church and then you end up going and the blessing be for you, that's how I feel right now. I feel so elated and empowered. Like, oh my God, I'm so glad I jumped in, and I wasn't going to come, and I did it anyway. Thank you. I'm so elated.
You're at the appointed place at the appointed time, and so we're thankful that you are here. Anybody else? Anything stand out for you about policy or about who might have been missing even from this conversation today that you wish was here? Tammie, Reverend Tammie?
Yeah, I think Ricky Fairley of Touch Black Breast Cancer Alliance had a beautiful perspective on this question.
Mm-hmm. I think, Ricky, I think that's you being voluntold.
Oh, well, I'm sorry. What am I being voluntold for? I'm sorry.
Who is missing from today's conversation?
Oh, I said HCPs. I'm sorry. HCPs. But I think we tackled that in our group because Tammie's taken them on. I just feel like
healthcare providers. I'm assuming
healthcare providers. It's healthcare providers because I feel like I have more control over helping teach Black women how to advocate for themselves, as opposed to teaching racist doctors how to not be racist. And so I'm gonna yield that one to Tammie, who's been doing that hard and like more aggressively. But I feel like I can be better and a better advocate by educating Black patients and help them understand what they're up against and how to stay stand up, like, you know, our young women did today. Oh, hold on a minute, I'm sick, fix it for me, right? So I feel like I'm in a better position to do that. And Tammie's got bigger guns. She's been doing this longer. She can go after those racist doctors and, you know, and tell them what they're doing is the wrong thing. So thanks.
I love that. I love that. And I love what you're speaking to something that I think is so important, Ricky. Everybody has talents and gifts and tools and they're different. And we all don't need to, nor should we all expect to show up in the same spaces in the same ways. And so it's great to hear how you are able to leverage what you've got for impact.
All things work together for good.
That's it.
Right. So we all have to play our part in this kingdom that we're in and fight with from all angles. So
yeah,
I thank God for my breasty Tammie.
Fantastic. Thank you. Thank you. All right. Any last comments before we go into wrapping it up?
I want to volunteer one more person. I'm gonna say her name so she can get her thoughts together before I say what it is. Summer Hayes. I think a person or a group or a voice that was missing from this conversation is definitely faith-based leaders. If we're looking at the Black community, it's not the only place that Black people can disseminate information to large bodies of people, but it is definitely one place for sure that has a history of being able to corral people and advocate in an advocacy format. And I'm trying to hold back because I want Summer to answer. I'm like, I don't want to answer the question. I want to ask her the question. But when I look at Summer Hayes is so well connected to so many churches and faith-based organizations, and she is doing phenomenal work in just helping move the needle in other areas. So Summer, can you speak to faith-based organizations and the need for them to join this conversation?
Yay. Hi, everyone. Thank you. I had my camera off because my internet won't let me be great, but here I am. So I work with a lot of faith-based organizations in the past, doing work surrounding dispelling myths about diabetes and hypertension, incorporating hands-on programs within the faith community, right? So we would go and paint lines so that people can have a path to walk. Literally, like go in there, create action. And I think the same action can be said for awareness and, you know, just surrounding breast cancer. And it was so many great things. It's almost like a pot of gumbo. Like, what do I eat first, the crab legs or the rice or the okra? Like, let's get it. But I think with faith-based organizations, oh my God, Tiara has this wonderful program in our breakout session she shared, and I'm just like, I got goosebumps thinking, how can we get these programs in faith-based organizations? And it's funny when Tammie was like, I gotta talk, I want one more person to say something. I'm like, that's me, let me get my camera together. But Tiara, like literally we can get this in the faith-based organizations. I have a group of faith-based leaders that I work with, and we meet on a regular basis, like bringing action. Like in her program is so simple, just a room big enough for a massage table. We can find that, you know, just working together and creating solutions and meeting women where they are. So I'm happy, of course, to help with whatever I can just to create this action surrounding that. So thank you.
Fantastic. Thank you, Summer. Even though you were voluntold, you were ready.
I know better. I know better.
Thank you, thank you, thank you. So now what I'd like to do, two last things. One is to give Reverend Tammie the opportunity to put the beginnings of tying the bow on it. And then after that, we're just going to take a few minutes and close out with appreciations. It's the way that, we usually close things out, to give people the opportunity to appreciate someone, something, or some opportunity. And I'll remind you what it is afterwards. But first, Reverend Tammie.
Wow, thank you so much, Natalie. You are such a rock star. Thank you for guiding this conversation and all that you bring to the conversation. And I tell you, I've got like a list of possible closings of what I want to say, where they are, what I want to say and how I want to say it. And in this moment, my heart is just filled with gratitude. And the best way I think to summarize this is that the right people that are supposed to be here, this is the right time. And the goal of our intimate conversations is almost like the experience of chemotherapy, but in a positive way. I won't say chemotherapy is negative, but in a more fulfilling way, without the negative side effects. But it really is cumulative. So today is conversation one, and then we will have additional conversations throughout the year. And then we'll hopefully build that coalition of folks that'll come to a training about how we actually come together and move legislation forward. And then we look at going into seeking an author for legislation that we draft together, to be able to say, okay, here's the problem. We know that the problem is big, but let's narrow it down. And what is step one? Strategically, logistically, what is step one? And together we get to move that needle forward. So in gratitude, I just have to close in thanking all of you beautiful, brilliant women and men who chose to be a part of this conversation, because you could have been anywhere. We started with one number, we ended with another number, but we are here, and that's what matters. And together we really can create the change that we want to be and see in the world. So thank you to all of you for being here.
Thank you, Reverend Tammie, for great closing comments. And now I would love to open it up to everybody who is here for appreciations, to appreciate someone. Maybe someone did or said something that really resonated deeply or was meaningful for you. Something, maybe you heard a new idea or concept that made a difference for you, and maybe you see the world a little bit differently, or some opportunity. So maybe someone is now a point of connection. Maybe you heard about some work that's going on that you wouldn't have known about otherwise. So appreciate someone, something, or some opportunity. Caitlin, and then Tiara.
I'd love to go first. Yeah, I really, and that's funny, Tiara's next, because I wanted to show my appreciation for Tiara. I think it's phenomenal that kind of through her story and where she is now, in the sense that she's truly helping in the community on, especially, she now has a site in South Central LA giving free mammograms, not even mammograms, breast exams, because it's better than a mammogram, to people in the community. And they're all telling their friends and family. And that's exactly what is needed to happen, to continue kind of promoting these stories and ensuring that people are finding cancer sooner than later. And so we can, again, move the needle against the 41% mortality rate. So I just really, again, appreciation to Tiara and to everyone at Carrie's Touch. I always have to thank Reverend Tammie for everything she does. And Natalie, you were an incredible moderator today, and all the speakers and panelists. It was moving to be a part of it. I'm honored to be a part of it.
Thanks, Caitlin. Tiara?
I just want to reach out to Reverend Tammie and just say I am elated to be a part of this conversation. It's truly an honor to share my story. This is actually my first time sharing my story on a platform like this. So it was a bit nerve-wracking for me because it's been 3 years and I never foresaw myself sharing my story in this capacity, but God has different plans for all of us. I was always very vocal about my journey, but never in this space, so it's a little scary for me to open up in this way, but it just allows me to continue sharing my story so that we can keep moving the needle forward, because I think every little bit helps. And the work that Reverend Tammie is doing and her team, it's an honor to be a part of the conversation, and I hope to keep the conversation going with you all. And, it was lovely to have such an amazing conversation with Caitlin and Summer in our breakout room. We kind of geared off a little bit, and we were just talking about the work that we could do in the future, which I think, we'd all applaud that we didn't necessarily discuss our questions, but really excited for the connections that have been made. And, thank you to Atiba for, introducing me to Reverend Tammie. And I'm talking a lot, but I'm just very, 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 very elated to be a part of this. And I'm truly honored, and it's a true blessing. So thank you all for everything.
Thank you.
Well, now that I'm over my shock, I would never have known that was So you may want to do this again. I'll just leave it at that. You did a great job. So thank you. Somebody else? Appreciation, Tammie, because you want to?
No, I just was seconding you saying that Tiara should definitely tell her story again. But Tiara, we can talk offline.
Phenomenal.
I would love that.
Charmaine?
I just want to thank Ms. Tawana again. Everyone did a wonderful job. Reverend Tammie, you were excellent in your opening, and you continued to be flawless throughout the whole time. The moderator, Miss Natalie, you are awesome. I appreciate your empathy and kindness to me when I was sharing. But Miss Tawana, you touched me today, Miss Lady. You touched my spirit. You dug on me deep. Somehow, some way, it was meant that I hear you today, and I heard you today, and I thank you for everything that you gave. It was heartfelt, and I'm gonna go with it. I'm gonna take it and run with it and stay empowered, stay in the fight. I'm gonna be my sister's keeper. I'm definitely going to stay on this battlefield. So thank you so much. You really empowered me today. I appreciate you.
Fantastic. Thanks, Charmaine. Somebody else you have an appreciation to share? And Megan, it's nice to see you. See you. Good to see your face. Anybody else an appreciation you'd like to share?
Natalie, can I jump in here?
Yeah, absolutely.
I just wanted to thank all of you because I have appreciation for all of you who were speaking today because you've touched on a lot of things that I'm a big believer that, when you tell one story, you're representing more than one person. And so thank you for making us all aware and opening our eyes and our ears today.
That's fantastic. Thanks, Courtney. Somebody else? Appreciation? I can throw mine in while you think. I just want to appreciate everybody who went into planning and putting this together. I'm sure you can tell it was a thoughtful endeavor. And it very timely for me personally to be involved in this. And so I'm thankful. The intersection of my personal experience and being here with you today is a meaningful one for me. And putting the slide deck together last night and was a process that was important to me to be able to share that with you. So I just thank you for me having that opportunity, and Atiba, who I've known too long and won't admit publicly, thank you for getting me involved and connected to Reverend Tammie and to Carrie's Touch and all these great folks. So that's my appreciation. So somebody else have an appreciation to share?
I do have to just jump in, Natalie, and just again, thank you for all that you bring to the table from the first moment we met to where we are today. It has just been nothing but a godsend. And like I said, with Representative Lamar, I look forward to this being the first of many engagements that we work on together. Sometimes it'll be your platform and other times it'll be our platform, but I look forward to what's next.
Absolutely. Thank you for having me. Ricky, I think you were unmuted for a moment. Did you want to go?
I was saying thank you for these conversations. We can't have enough of them. So appreciate all the talking, all the, and now we just have to walk the walk. So thank you for just talking, extending this conversation, especially to young women. So
that's great.
I appreciate you, Tammie.
And Tawana, Reverend Dr. Davis.
I am absolutely grateful. Just to follow up on Ricky's statement, just when we get together, and power is energy, and when that energy begins to connect, because you got to tap into power in order to be empowered and have that energy. And when Charmaine and I were in the room, it was the two of us, and just the outpouring and the trust and the storytelling, and it just happens. And I'm grateful for everyone here who just unapologetically and openly shared their experiences, their stories, their questions, the hard questions, the challenges that they have. So thank you to everyone, particularly Charmaine, because that's the one I had the one-on-one conversation with, and how the church analogy just sent me in. That was so true. Like one of those things where, okay, I'm not feeling well, I'm not going to go. And then you end up going and being blessed tremendously. And I think I knew I was going to be here, and I knew that I was going to be blessed. And I'm so grateful for this team and this community. And I look forward to great things to come.
Thank you for that. All right, we're getting ready to count it down. So if you have it to say, it's burning and urgent, I'm gonna need you to go ahead and dig deep and step forward. This is your time. You don't want to miss your moment. They say shoot shot. Come on now. What do you have? What do you want to do?
You ladies rock. You ladies are awesome.
All right.
I'm just living my motto here on my cup, which I know Tammie is. Get shit done.
I know that's right. That's like preaching a word. Yes, I think you're talking to the right people.
We're all doing it, right?
I
Tammie and Tawana every day.
It's a great thing. Anybody else? Counting it down. 5, 4, 3, 2, 1. It is a wrap. Thank you all so much for being here. And I am sure that Carrie's Touch will be in touch with you all to share information and some of the follow-up items that were discussed today. So stay tuned for those things and keep an eye open. And I was just happy to be here with you all today. Take good care. Thank you.
Thanks.